Welcome all. Question for the day. What is the rationale of using methotrexate in rheumatoid arthritis? We all know methotrexate is a disease-modifying anti-rheumatoid agent. So it's a primary drug which is used in the treatment of rheumatoid arthritis, which will acts by stopping the progression of the disease. So, before knowing the mechanism of action of methotrexate, we need to know what is a key metabolite which is involved in the mechanism of action of methotrexate, and that is called ICAR, that is amino imidazole carboxamide ribonucleotide. So, this is a key metabolite which is involved in the mechanism of action of methotrexate. Now, when you give methotrexate, what happens? Methotrexate will be converted to its active form, that is, it is converted to its active polyglutamate form, and it inhibits this ICAR transformylase enzyme. When this methotrexate inhibits this ICAR transformylase enzyme, what happens? So for that you need to know what is ICAR transformylase. This is an enzyme which is involved in purine metabolism, and the function of this enzyme is it will metabolize the ICAR to formyl ICAR. So when this ICAR transformylase is inhibited by giving methotrexate, what happens? ICAR will be increased, so there is accumulation of ICAR. So when there is more amount of ICAR, it goes and inhibits two important enzymes which is involved in adenosine metabolism, and those important two enzymes were ADA, that is adenosine deaminase, and AMP deaminase. So these are the two enzymes which is responsible for adenosine metabolism. Or these are the two important enzymes which are responsible for adenosine metabolism. Now, when ICAR inhibits this ADA and AMPDA, what happens? This adenosine level will increase. So when there is increase in the level of, when there is increase in the amount of adenosine, what happens? Adenosine from the intracellular, it comes to extracellular via transporters, and it will go and act on the receptors which is present on the surface of the inflammatory cells, like T cells, macrophages, neutrophils and all. And when it acts on these surface of the inflammatory cells, what happens? It will suppresses its function, and then it decreases the production of pro-inflammatory cytokines like TNF-alpha, interleukin-6 and all. So as a result, what happens? Inflammation will decrease. So joint inflammations in the joints is decreased. So this is the important mechanism, how it produces its anti-inflammatory activity. So this is the rationale why methotrexate is used in rheumatoid arthritis. So apart from that, we need to know methotrexate also directly, it stimulates the apoptosis of immune inflammatory cells. Methotrexate, it directly stimulates the apoptosis of immune inflammatory cells. So this is also one of the reasons why we are using methotrexate in rheumatoid arthritis. And then you need to know an important point. Methotrexate is an anti-cancer drug. So when compared to its anti-cancerous dose, the dose which is used in rheumatoid arthritis is very less. Like we should use 10 to 25 milligram per week orally. So this is the dose which is used in rheumatoid arthritis. Thank you.